first, there are two main categories of asthma. The first type is called intermittent asthma. Intermittent asthma, those patients go along, they run into a cold or something that triggers them, they go down. If you treat them and you get them completely clear, just like this, completely clear, stop all the medicine, they stay fine until the next time that they run into their trigger. In intermittent asthma, all we do is to treat their flares when they come along. The other type of asthma is called persistent asthma. And in persistent asthma, they go along, run into that same trigger, they go down. If we treat them until they get completely clear, stop all the medicine, within the next week or two, even without a new trigger, they start sliding back downhill again. You may have seen the ads on TV for Advair, Singulair, Flovent, Qvar, Symbicort. Those kind of medicines are used in persistent asthma to keep them well in between their flares. So in persistent asthma, they always have a little rim of that inflammation down there. And we use the regular scheduled medicines to try to keep that little rim from coming back once we've gotten them clear. Those medicines like Pulmicort and Advair, Singulair are not potent enough to do anything to get you clear. They are meant to keep you clear if you have persistent asthma. In intermittent asthma, though, since their airways are already clear, those medicines don't do anything. So patients with intermittent asthma, they don't get any benefit out of using the regular scheduled medicines, just if you have persistent asthma. And we do that for three main reasons. One, you want to get rid of the regular symptoms. And I think that that's what most people focus on. That's probably the least important reason to me. So if you're having a little bit of cough on a regular basis, hopefully we can get you on a controller that would keep that cough from happening routinely. But if that was the main reason, I say I have patients who cough 2 or 3 times a week, and because of that they have to take a medicine every day. That in itself wouldn't be enough reason to take care of that. The second reason, though, is that when you have even a little rim of that inflammation down there, it makes those air tubes a lot more sensitive, so that it's easier to go off when they go off, they can go off harder, farther, faster, and take longer to get back up to clear. And the third reason is that if we leave that little bit of inflammation down there long term, it turns into scar tissue, and then it's permanently damaged. And then the swelling starts to come off the inside of the scar, so it can get worse over time. So for those reasons are probably more important reasons for persistent asthma, to try to keep them clear in between their flares. When I ask patients what's the longest you've gone completely clear over the last year, patients who have intermittent asthma usually tell me they can go 2 or 3 months, especially over summer outside of the viral season, when they're absolutely perfect. Whereas when I ask persistent asthma patients what's the longest they've gone completely clear over the last year, often they will tell me not more than a week or 2. Sometimes it's very hard, especially for young kids, to know for sure because of how often that they get colds. What's more is if somebody hasn't been treated until they're completely clear, it could be that their intermittent asthma is just dragging on. And so a lot of times at the beginning, we first have to try to treat somebody until they're completely clear. Then we stop the medicines and we watch and see what happens. Do they stay clear until their next cold, or do they start sliding right back downhill again, even without a trigger? So most people want to know up front whether their child will continue to have asthma long term. And chances are is we won't be able to answer that for certain now. But I can tell you from the long-term studies, and we have some that are pretty good, is those patients who truly have intermittent asthma, almost half of those had it eventually just kind of fade away. Whereas Whereas those who had persistent asthma, especially if they were well controlled, sometimes they would go into a remission state where they didn't have to take any medicines and they didn't have any symptoms, but it always came back. And so if it is intermittent asthma, then there's a good chance that this is something that will end up fading away and we won't have to deal with it anymore. But if it is persistent asthma, then it's something that they're probably going to have to watch for, at least intermittently throughout life.